Hey everybody, I'm Terrica.
And I'm Mikail.
Welcome to episode 1 of Shades of Health podcast. The topic for today is healthcare a scam? We do just want to preface that any advice or any opinions from this video is not intended to be a substitute for professional medical advice. Always seek the advice of your physician.
All right. Absolutely. All right. So I saw a post
Mm-hmm.
that went viral on Facebook. It said, if medicine worked, you wouldn't have to refill your prescription.
Yes, I saw that post as well. Very, very two-sided. Very
hmm
two-sided.
hmm How do you feel about
Um,
that?
um, I think it just depends on how you look at it. Um, so yeah, it just depends.
So, do you think healthcare is more about treating symptoms versus the finding a cure for the root cause?
I think that when we think about it from a perspective of when do patients come into healthcare systems, when do they come to the hospital? A lot of times we see patients, and at that point, we're like trying to prevent them from getting worse. Like they're already at a bad spot, right?
hmm
So a patient comes in and their A1C is 15. We can't talk about preventative care at that point.
hmm
We're talking insulin, we're talking diabetes medicine, metformin, what have you. Like we're past that point. So I think it just all depends on at what point are we seeing these patients
hmm
versus, you know, can we talk diet and exercise at that point?
Right. I totally agree. That's why preventative health is so important to try to stop these things from happening or getting to that point in the beginning. But absolutely, at some point, it's no longer preventative. Now we're like treating.
Right. We are treating the symptoms. And going back to the Facebook post, if medicine was a cure, then you wouldn't need refills. But I don't personally feel like medicine is advertised as a cure.
hmm
We are at that point trying to prevent progression. We're trying to prevent the disease process from becoming worse. So, unless patients are more willing to change their lifestyle in addition to medication,
hmm
everything is about a lifestyle change, your diet, exercising, your mental health. Like all that plays a role into your health. So,
Absolutely.
yeah.
Absolutely. And I think it's just playing into a fear narrative that, healthcare or the people in healthcare are really against you and just to take your money. But sometimes a lot of these things are self-inflicted, poor
Right.
education. So yeah. Um, Once you get a certain illness like high blood pressure, diabetes, it's almost a lifetime situation.
Right. Right. I mean, you do see those reversals,
Mhm.
people who had high blood pressure, um, you know, don't have it anymore.
Mhm.
It's rare because a lot of times people don't want to change their lifestyle.
Right.
Lifestyle changes are the hardest for sure. It's not about a diet, it's about a lifetime. So, yeah.
Absolutely. All right. Do you think the system prioritizes profit over patient care?
I don't think so.
hmm
Um, Healthcare is a business in the United States. So hospitals and clinics are out to make money. It
hmm
is a for-profit business, but patient care is a priority. Um, there's always going to be that bad apple in the bunch. You hear a lot of times on the news about physicians who have been over-treating or under-treating, but patient care is still a priority. You also going to meet a lot of people who are going to help you along the way,
hmm
and actually be compassionate about it. So
hmm
I don't think so. What you think?
Um, I think it's definitely about patient care. Because we are in a capitalistic society, they have found a
Right.
way to profit off of it. But at the top of our concern is definitely patient care, because I mean we want to make sure everyone is healthy, making sure they get what they need. You know, nobody wants to see anybody like super sick if we can help, you know.
Right, right. I always hear people talk about like when you go to the emergency room and there's the person who comes up to you to ask you about your insurance. I don't know if you've
Mm-hmm.
seen those people like in the
Mm-hmm.
emergency room.
Mm-hmm.
And people always talk about that. Like that is very interesting. And if you're on the other side of things, I can see how people are offended by that.
Mm-hmm.
But like I said, it is a for-profit business, and so they do want to know that they're going to get paid. You know, they do
Absolutely.
want to know that you either have insurance or you don't. A lot of people don't know that when you're self-pay or you don't have insurance, you know, it's a different process
Mm-hmm.
than when they're filing insurance.
Mm-hmm.
So, but yeah, it is. It sucks. Have somebody, you know, your arm's broken, and they're like, "Do you have insurance?" You know, yeah, it sucks. But yeah.
It does, but unfortunately, that's our society,
Right, right.
and they have to get paid. So,
Yeah, yeah. So,
all right, is health insurance truly protecting us, or is it just another way to trap people into paying more long term?
hey, I'm gonna be honest. I am pro insurance. I'm pro insurance for everything: car insurance, house insurance. I'm
Mm-hmm.
just one of those people. Like, I do not like the unknown.
Mm-hmm.
Do I like paying healthcare every month? No, I
No.
don't. I don't like paying my car insurance either. But um, it does serve a purpose. I think one of the things is just people don't understand like the terminology. So deductible and copay,
Mm-hmm.
out of pocket maximum. We're not really educated on like those terms and like what that means. So when we pick plans, insurance plans through our employers, a lot of people just don't know what they're picking. And so when they show up to the ER and the deduct or the copay is higher than like when you show
Mm-hmm.
up to the doctor's office, they're confused, and
Mm-hmm.
it's just a lack of education on their
Mm-hmm.
part. But I do think insurance is expensive. Don't get me wrong, because a lot of people can't afford it.
Mm-hmm.
But I've had a $30,000 hospital stay before, and I would have been so sad to get that bill. I still had to pay about 3,000 out of pocket, but
Yeah. Yeah.
better than 30.
It
So
feels like a scam until you actually need it, and then when you
right,
need it,
right,
you like, I'm glad I got it.
right,
I'm on both sides of the spectrum. I don't feel like they're trapping, it's a trap, but I do feel like as a provider, they do give us a lot of red tape to go around to try to
hmm,
actually help the patient. And so like sometimes it's definitely there to protect it, but
right.
sometimes it can be difficult to maneuver because they're
Mhm.
trying to protect so much. And sometimes we may disagree with them, but for ultimately we're both advocating for the patient. So
Right, right. And there are a lot of barriers to insurance too. Like if you're unemployed, I don't know all the details about like Medicare and Medicaid,
mhm,
but everybody doesn't have, I don't think everybody has access to even that.
mhm,
Um, so there's a lot of barriers,
mhm,
and obviously our race, African Americans, there's a disparity with, how many of us have adequate health insurance or health insurance at all.
mhm. But there are
So
resources out there. So I know for the facility I work for, they offer a whole bunch of resources to get insurance, to find information out there. So it's definitely available for those who want it. So
right, right. Yeah,
mhm,
and that goes back to what we were talking about as far as like education or just knowing that there are resources and people being willing to ask questions.
mhm,
So
mhm.
yeah.
Yep.
Hence.
All right. So you want to read this one?
Yeah, so this one, are patients given enough autonomy in their healthcare decisions, which means given choices, or are they
Mm,
often pushed into costly treatments without fully understanding their options?
it's a tough one. Um,
It is. Um, I think that sometimes patients or sometimes physicians or providers have a set plan in there. mind based on whatever the condition is, especially if they've seen this condition a lot and they know that this one way works, right? So they may present this one option to a patient, although there are five other options. And so I think it's our job as patients to ask questions.
Mm-hmm.
You know, ask, are there other treatments? If you're not comfortable, if this is a invasive procedure or surgery and you know you don't want to do that, like um it's all about educating yourself, doing your own research, asking questions, not feeling like the one thing that they present to you, the one thing that the provider presents to you is the only option.
Mm-hmm.
Now, there are some times where that one thing may be the only option, you know, but not something saying it's not. And so yeah, just advocating for yourself is the most important. So
Mm-hmm.
what do you think? Like, or
Um,
what do you see in your practice that, you know, how do
um,
patients, like, do they ask questions or
some of them do. Some of them do, but for the most part, most of them don't.
yeah.
And a lot of it is because they truly don't know what to
Mhm.
ask,
Right.
how to ask them. And a lot of them don't even have a full understanding of their issue or what's going on with their body. So I always ask them, if you have this, what does this mean to you? Or like if
Mhm.
you have diabetes, what's diabetes mean to you? So that,
Right.
because I feel like the more education you have, the better you can help yourself, the better we can come up with a treatment plan for you. And oftentimes they'll be like, well, no one has ever even asked me that question. So,
Mhm.
coming from our community, when we see like grandma or auntie with diabetes or the sugars, it's like, oh well, she's still able to go and, eat this, eat that, and she's okay. But on the flip side, they're not seeing grandma got, kidney failure,
Right.
sugars off the chain. So like, and a lot of times I think like the autonomy kind of leaves in that situation because as a provider, I know what's going to probably work for them in that moment,
Mhm.
depending on what level or stage that they're in. But I do think more education would help with them being able to like ask the questions that they need, or to have someone
Right.
in a room that can advocate for them as well.
Right.
So definitely education is of
I've
importance.
encountered a lot of patients, you know, as a bedside nurse who, you know, African American patients who once they saw me
Mm-hmm.
felt more comfortable asking a question, you
Mm-hmm.
know, and could ask it how they wanted to ask it. You know,
Mm-hmm.
a lot of our community fear being looked at as uneducated.
Mm-hmm.
And so they don't want to ask, you know, a doctor of another race
Mm-hmm.
you know, a question and they don't know how to word it.
Yes.
So the more that they see us in the
Mm-hmm.
field makes them more comfortable as well
Mm-hmm.
to kind of ask those questions. And
Mm-hmm.
also patients just understanding that it's okay to not know at that moment and be like, can I think about it? You
Mm-hmm.
know, can I call back or can I schedule another appointment? Can I, you know, can I bring somebody with me if I don't understand? So
Yeah, and
those are other options too
I agree.
that
And I
that
think
people
being
don't
able
know.
to create a space for them to be able to do that is good too.
Mhm.
And definitely, Terica, like when they see that you mimic them or you look like them, you can see
Right.
the tension leave. And I tell you, the
Mhm.
conversations,
Yeah,
the
they get pretty personal.
they do, and they get, yeah, they do.
Yeah, I've had people tell me their whole life story, and I'm like, "That's good,"
Hmm.
you know. But what are we gonna do about now?
Hmm.
So
And
yeah.
like I've found myself being able to reach them as well, way
Mhm.
better, than with the other, providers or whatever. And then being young, and I get young people in, it's almost like they're speaking to their peer. Um,
Right.
so yeah.
Yeah. So.
So I don't think they're being pushed into costly treatments. Sometimes they are, but sometimes I just think depends on what side of the coin you on at that
Right. Right. I agree.
point.
All right. So, how do you feel that pharmaceutical companies, medicine companies, I should say, play into this narrative? Do you think that their focus is on health or on keeping people dependent on medication?
I think they're I think they're working. Yeah, it got me tight tongue.
I think it's a
I
combination
think
of both. I mean, A little
I
bit of
think they're
both.
about them. I'm gonna be honest with you. I think they're about their bottom line, getting
Yeah,
paid.
yeah.
But
It's a
they
for
have to
profit
be.
business.
It's a for-profit business.
Hmm.
Um, but as a provider, my job is to make sure that the patient is getting what they're needing, and that they can be helped, and if possible, coming off of medications.
Right.
So.
Yeah, I think medicines work, and there is a lot of medicines have been around for years and
Mhm,
years. A lot of this stuff isn't new.
mhm,
Um and so it does work. I mean, yeah, you have to take into account allergy. Like just because your grandma took a medication and she had an allergy to it doesn't mean that you're going to take that same medication and it's not going to work for you.
mhm,
You see that in our community a lot as well. Like, oh, but it made my mama, you
mhm,
know, give her chest pain. It's going to, no, it's like, every medication does have side effects.
mhm,
And so that kind of goes back into what we were talking about as far as educating ourselves, um, about medicines and the possibilities. Just because there's 10 side effects, you might experience none
mhm,
of those side effects. You might experience two. So education is key, research is key, just knowing your options is key. Once again, going back to medicine not being a cure, and so unless you do those lifestyle changes, depending on what the disease is, we know that everything isn't curable and some things are lifelong.
mhm.
um you know so but
Chronic
medicine
versus
is
acute.
expensive. Yeah, we probably gonna touch on that a little bit later, but
Mhm.
medicine is expensive. So
I was gonna go into the natural versus prescribed, like, because I know you do a lot of natural things. What's your take on that?
okay, so um so my mom's like a really holistic person. I always joke with her that she's a doctor, but
Mhm,
um there are a lot of holistic natural ways to heal ailments and to treat disease processes, right?
mhm,
So I just think it depends on how far you are into that disease process, right?
mhm,
So education, like I don't take anything without doing my own research. Um and so but there's a lot of promise to it too. Me personally, I have been diagnosed with a autoimmune disorder, and I did my own research, found me a herbal tincture. I have not had a problem since.
mhm,
Once again, a disclaimer. uh, you know, but yeah, I just think it depends on where you are in your disease process. Like
mhm,
he gotta do his best for you.
mhm,
And even though I'm in the medical field, I'm not one that's gonna allow a doctor to tell me to take just anything.
mhm, mhm.
That's just me.
I
So,
agree. I agree.
you know, and I'm not saying that my doctor was just gonna make me take anything, but
Mhm,
I just wanted to go that route first because I felt like I wasn't too far gone, if that makes sense.
mhm.
So, but yeah,
And I'm gonna preference this, like, because I do get patients that come in saying they're like on apple cider vinegar and sea moss. Personally, I don't know anything about this stuff, and I'm
yeah,
not saying that it doesn't work, but I can tell you this: if you come in and your A1C is greater than 15 and your sugar is 500, and you done told me that you didn't got off of your medication to try
right,
that, I'm gonna probably look at you a little crazy because I'm gonna
yeah,
be
yeah. We
like,
gonna put CMOS on the back burner in that case.
and I always tell them, I'm gonna be like, I'm not saying that it don't work, but what I'm telling you now,
Right.
this is gonna work for you, and you can do both of them, but
Yeah,
let's
yeah.
work on something that I know that's gonna probably be effective.
Right. We gotta get you out the woods first, and then we
Fact,
can talk about the
fact.
holistic. Yeah, yeah. So,
But yeah, I think that's a lot of people's concern. Well, I was told, that I like to do natural things. Okay, that's
hmm,
cool. That's
yeah.
fine. I'm not saying it don't work. I'm just not well versed in.
Right, right. And that's what I said. I mean, a lot of providers aren't,
Mm-hmm.
and so if you come to them talking about sea moss and, valerian root and turmeric, they're going to be like, what? Like, they just not educated on it.
Mm-hmm.
So just let them know that you are taking it, because a lot of things do affect other medications.
Yeah,
Yeah,
conflict.
and yeah,
Mhm.
so be honest with your provider for
Mhm.
sure, because you don't want to mix the wrong things.
Mhm.
But just also know that they may not be educated on it, and that's
Mhm.
okay. But as long as you're open and honest with them, then they can do the research that they need to do and make sure
Mhm.
that they're not contradicting anything that you're already
Mhm.
doing or that you plan on doing anyway. So
And also, like, just to be careful on like buying things online, like
mhm.
Amazon, different places, because some of this stuff isn't FDA approved. But that's a
Right.
whole nother
That's
conversation
a
for a
whole
whole nother
nother
day, and we
conversation.
will be getting on that. Finding things on social media,
Yeah, we're gonna talk about that for
part
sure.
two.
Part two. Social media is a whole nother game. Okay.
All right, hold on.
You
Okay.
good. All right. Is preventative care discouraged because it doesn't make money? This kind of touched on what we just kind of
Mm-hmm.
elaborated on. I guess we didn't know that was the next one,
Mm-hmm.
But just to go back to me saying that a lot of times once we see patients, they're past the preventative point. Like
Mm-hmm.
a lot of patients don't see a doctor until they're sick. They don't do the whole 1 year checkup, especially men.
Mm-hmm.
You ask a man when the last time they've been to the doctor, and it's like when I was born.
Mm-hmm.
Like like, well, great. So yeah, people don't follow, through with their checkups regularly. And
Mm-hmm.
so a lot of times preventative care isn't even an option.
Mm-hmm.
You know? So
And so I also tell my patients, like, okay, just because you never had it doesn't mean that you never had it. So
mhm,
like they'll come in and be like, well, I've never had these problems. I've never had hypertension, but your blood pressure is 171 over 120.
right.
This is not white coat syndrome. This is not, I'm just nervous because
We
I'm here at the
we
doctor.
had stroke syndrome.
We're in stroke. I'll tell them I can see you to the hospital right now and they probably accept you.
Yeah.
And then it's
Yeah.
like, well, can I work on, diet and exercise? Yes, absolutely.
Yeah,
But
for sure. Yeah.
you need something to help you at this point.
Right.
And so
Yeah.
then I hear Terrica, they'll be like, well, every black person at this age is gonna be told they have high blood pressure, diabetes. Y'all do that. I'm like, no, we're looking at numbers. Your numbers are saying
Right.
this is
That you
what you
have
have.
it. Yeah. I mean, but that does follow a trend. They're right.
Mm-hmm.
Like, and there's a reason why at a certain age more African Americans are likely to be diagnosed with high blood pressure, diabetes, asthma, well, whatever. Like, because we don't take care of ourselves. We wait to the last minute. You know, our vision is blurry and we can barely see, and we show up like something's
Mm-hmm.
wrong. Yeah, your
Mm-hmm.
blood pressure's through the roof.
Mm-hmm.
Yeah. So
You gotta take care of yourself. Gotta
yeah, you
gotta
gotta take care of yourself.
you gotta get those preventative visits in, especially from the ages of, I would say, late 20s to your early 30s. Like that's when we're actually
Mhm.
checking for diabetes, high cholesterol, all
Yeah.
those different things, because that's really when it starts to set in.
Right. And
And it's
even earlier if it runs in your
Mhm.
family,
Absolutely.
you
And
know.
it's important, like, to have those lifestyle changes early in life, so when you get to a certain age, it won't be so hard to do those things.
Right,
Um,
right.
but yeah, definitely, like, definitely get your blood work, definitely get those STDs checked. That's another conversation.
That's another episode. That's
So it
another
is very
episode.
important. And when the provider tells you, hey, you are pre-diabetic, hey, you need to get serious, you
Mhm.
know, get serious about it, because that's how you prevent being on medications.
Right.
The
Yeah.
lifestyle changes. So the salt, the sugar, I tell my patients, it's not necessarily what we're eating, but what we're eating with the food. Like, what are we
Right.
putting on the food?
How we prepared the food
How we
is the
prepare it.
problem. You can
Yep.
have catfish, you just can't have it fried all the time.
All the time
Like lemon pepper honey hot.
with the hot sauce.
Hey, that's my favorite, but okay.
Not every day.
Not every day though. Not every day.
All right. All right. Do patients understand their rights in the healthcare system, or is the lack of education part of the problem?
Yeah, patients do not understand their rights. You can say no. You can say no. I think that's the thing that a lot of people will. I've seen a lot of patients who say no, but I've
Mm-hmm.
also seen a lot of patients who say yes to everything.
Mm-hmm.
Every test, every exam they offer, just everything. They just want it all. So yeah, patients don't some a lot of patients don't understand their rights in the healthcare system as far as asking for alternatives, asking what are your options, asking for time to think,
Mm-hmm.
asking for a support person. Those are things that cannot be denied.
Mm-hmm.
Um, but yeah, lack of education is definitely the problem. So
Yeah, I totally agree. Um, I always say, hey man, you can say no. If you don't feel like you need this appointment today, you do not have to show up today. Like you're not
right.
required to be here. Um, it's just they just don't know. And I want to say there's an excuse for that, but then I also want to say we Google everything else,
Yeah.
and we on Facebook, we on Instagram, and we
Yeah.
looking up different things. We can take the time to look up different things about our health and like the options that we have. Like what medication am I on? Like is this normal? Like we got
Hmm.
the time and the resources to do it. We just need to put the effort into it.
Yeah, for sure. I
Hmm.
agree. So, oh, this is a good one.
Hmm.
Do providers use platforms and databases to provide answers for patient care? Is that safe? Does that make patients feel they are less trustworthy or reliable? And by platforms and databases, we mean like educational platforms and databases. Jokingly, Google. Do
do,
providers use Google?
do providers have their own Google?
Right. Yes, providers do have resources available to them to look up your condition, because a lot of people don't understand that you come in and you are the one in 10,000, or you have 10 other things going on top of what you're coming in for. And
Mhm.
so, we're human.
Mhm.
We don't have everything stacked in our brain, we haven't seen every single condition out there, or
Absolutely.
every single combination of conditions. And so, if a provider says, "Hey, let me step out and research that," or "Let me consult with my colleague," please let them do so, and don't
Mhm.
feel that they are not competent. Like, they are competent. It's just they want to make sure that they're touching all bases.
Mhm.
And what's your viewpoint as a provider? I'm sure you've seen some things that you haven't seen before,
Oh,
or
absolutely.
yeah.
Especially when the symptoms are very, very like vague.
Mm-hmm.
Um, yeah, it takes time to put it together. It's called the practice of medicine, not the absolute.
Right.
Um, and we do have resources that we use. That is not Google.
Mm-hmm.
It's evidence based practice, which means that lots of research has gone into it. These are the tools that we use to make sure that the treatments are best. So
Right.
yes, because we don't see. It depends on your practice too. Like I might not see certain things every day. So I'm
Right.
gonna go get help. I'm gonna go get a tool. I'm gonna go get a resource to make sure I'm treating you appropriately because I care and I'm not here just for your money. I want to
Right.
make sure I don't harm you in any type of way. So yeah, we do. And it doesn't mean that we lack education.
Right. Yeah. I mean, when you think of it, like, for me, most of my background was babies,
Hmm.
and so I have family members contact me all the time, and they're like, "Tell me about this," and I'm like, "I don't know. I'm about to look it up just like you." Because I haven't seen it before.
Hmm.
And
Hmm.
so I don't remember adult health from nursing school and everything that was in there. I mean, it's just the reality of it.
Hmm.
But understanding how to find the information and not relying on TikTok and Google all
Hmm.
the time is very important. Just
Hmm.
knowing that your information is credible is
Hmm.
important. So,
Absolutely.
but yeah.
Um, I had something else to say, but I forgot. So
It's okay.
we'll
If
keep
you
it
think
moving.
of it, just come back to it. Oh, that's the one we just
Oh, we
said.
already just went there. Okay.
All right. Are medical debts and bankruptcies proof that the system is broken? Yeah.
Absolutely.
It's really sad that a lot of patients, experience foreclosures on their home and their cars are repossessed because they're in medical debt. Their credit scores tank. Actually, it was a new. Do not quote me, but there was a law passed recently about medical debts and the amount that can be,
Collected.
yeah, and posted on your credit report.
Mhm. I
Don't
think
quote
I
me.
heard about that too.
Yeah, I think it's 2,000, but do not
Okay.
quote me.
I even
But
thought they said they weren't even gonna do that anymore. Like put it on your
and
credit
it may
score.
have changed. It's been a minute since I
Yeah.
looked at it. But yeah, I mean it kind of just it sucks because a lot of patients, these are unexpected things. We're talking car crashes and trauma. You see it a lot, like stuff that you didn't expect to happen to you,
Hmm.
and it might have been during a time where you didn't have a job. And so you didn't have health insurance. And now that's, a self pay bill.
Hmm.
Um, so yeah, it is, a negative for sure about our healthcare system.
I do, and I think that goes back to when you were saying to have the insurance because when the
Mhm.
unexpected happens, then you have that cushion there that can kind of buffer a lot of these issues. And the thing about insurance, like if you don't know, ask. Like no
Right,
question is a dumb question. And
right,
no matter what anybody says, if you don't know, it's best to get that answer or get the help that you need so you can better advocate for yourself.
right.
I absolutely agree. Like no one should be losing their house or
Mhm.
garnishing their checks because they couldn't afford the hospital bill for an issue that they couldn't help. And
Right,
that's
right.
a part of our society being broken and putting
Yeah,
profit above, you know,
yeah,
a
the big.
person.
Yeah, I think too, just a educational piece for everybody who's watching. Utilize social workers,
Hmm.
case managers in the hospital, especially. I believe clinics have those. Is
We
that
do.
right? Okay,
That's
yeah,
good.
clinics have
Depending
them
on
as
where.
well. And they are your point of contact for those social issues. So insurance, transportation. If you don't have transportation to your appointments, from your appointments, like those are your people. That's what they're there for.
Hmm.
So just utilizing those services that are offered is super important as well.
Hmm.
So
Absolutely.
yeah.
Absolutely. All right. And so we're headed towards the end of today's episode. But Terica, if you could change one thing about the healthcare system, what would it be?
If I could change one thing about the healthcare system, it would be that everyone who works in the healthcare system is compassionate and love what they do. That is like the heart of healthcare. You meet so many people from different walks of life. You realize how blessed you are that you are one bad day away from them, in the situation that they're in. And every day is not easy.
Hmm.
You encounter patients who really can be difficult, but you have to understand like where they are, and how pleasant can you be when a doctor is telling you the most devastating news of your life, and just, that is why that compassion part is so important. So that's what I would change about the healthcare system. In addition to, it just being less expensive,
Hmm.
you know, but having compassionate healthcare workers, make it, that everybody had that would be super important. So,
Absolutely.
what about you?
For me, I would say to be able to spend more time with my patients, to give them what they need, and not be worried about a schedule. I also say for the healthcare system to have compassion on the people who's working in the system. I think a
Yeah.
lot of focus is on patient care, and I believe as a healthcare worker, as healthcare workers, we are always going to keep the patient at the forefront of care, but we also need that compassion and pouring into as
Mhm.
well. And I think
Right.
it'll also trickle down to everywhere else.
All
It
right.
needs to
And
be.
we have to remember to take care of our mental health, take care of
Mhm.
ourselves. We are actually some of the worst with, just keeping up with our appointments because it's
Mhm.
hard,
Mhm.
with
Mhm.
just dealing with day to day life and then working in that field.
Mhm.
A lot of nurses I know have a hard time getting off work,
Mhm.
for a doctor's appointment, just for a checkup or whatever. So
Mhm.
we just have to remember to take care of ourselves and do the best we can as well.
Absolutely. Absolutely. And it brings us to our last question. Is healthcare a scam?
It depends.
It
What do
depends.
it depends on what you define a scam as,
Mhm.
and how you look at it. Also depends on your experiences.
Mhm.
If you've had 10 bad healthcare experiences, you're going to say it's a scam. If
Mhm.
you've had none, you're gonna be like, oh no, the healthcare system is great.
Mhm.
So it's definitely a double-edged sword.
It is. It is. And for our viewers, do you think healthcare is a scam? If so, if not, comment and let us know about your experiences.
All
Until
righty,
next
we
time.
will see you all on episode 2.
All right. See
All
you.
right, see ya.